Welcome to Facial Plastics Friday. Dr. Brace here, and for today's topic, it's a question I get often, and that's, what do you do for your skin, or what do you recommend for somebody that's over 40? What treatments would benefit me in particular? And so I can tell you what I have done. I have Botox in my forehead, I use skincare, and I've done Profound as 3 things, and then there's some things I'm considering, but let's break it down. And so when you think about what you could do to slow the aging process or to reverse some of the aging process before you get to surgery, it all starts with skincare. That's the most important thing. And there are 4 basics to skincare that you should consider. The first one is an exfoliator, and I like to use the weak acid exfoliators because they're not abrasive on the skin. So something like an AHA or alpha hydroxy acid exfoliator helps remove the dead layer of skin that's on the surface and lets everything else you use penetrate better. The second thing you should be thinking about is a retinol. A retinol is a vitamin A derivative. It causes this turnover in your skin to speed up, so you always have fresher, newer skin on the surface. It can help with pigment, can help with fine lines, and it really is the tried and true tested skincare molecule that really helps people's facial skin. But if you use retinol, you're gonna get dry. Sometimes people use it and they say, I got red and flaky, I'm allergic to it, I can't tolerate it, but honestly, that's what happens to everyone. If it's working, it's going to do that. You have to push through that initial stage where you're dry and flaky, and then once your skin gets used to it, then you'll start to see the results. And that can take 16 weeks or more, because it usually takes 3 skin cycles, which are about 6 weeks each, to really start to see the effect. So 18 weeks, not 16. And then if you're using retinol, you also will burn easier in the sun, and you want to prevent any further sun damage, which is what ages your skin. So a good sunblock is the 4th ingredient. So if you exfoliate, use retinol, use moisturizer, and sunblock, that's what's going to give your skin its kind of basic priming to help reverse some signs of aging and slow down some signs of aging. That's kind of like diet and exercise. So when I tell people about skincare, you don't lose weight quickly just like that because you decide one day or because you do boot camp, but it's diet and exercise that gets you there. But the boot camp for your skin would be some of the energy devices. Profound is radio frequency microneedling, and the reason I like Profound is that it's paired. So the needles that are in that device actually pass the energy between the needle points when they're in the skin. And why I like this is because it's more controlled. The energy isn't just going anywhere it wants in your skin, but it's actually passing between the needles that have temperature probes on them. It checks the temperature 10 times a second. It ensures that we're getting what we want. And what happens is you partially denature the proteins in your skin, and then your body heals and it makes more collagen, more elastin, and more hyaluronic acid. So the end result is thicker, more hydrated, more elastic skin, which looks more youthful. The other thing that I like, so number 3 after skincare and Profound, is CO2 laser. If you have any degree of surface sun damage to your skin that's not going to go away or get better with retinol, the CO2 laser is like sandpaper, if you want to think of it that way. If you have a rough piece of wood and you want to smooth it out, well, you want to resurface it. And the CO2 laser can be done extremely lightly or extremely aggressive, but it does give you a good resurfacing and a smoothing of the tone and texture of your skin. And then the final thing that I mentioned is neurotoxins, or Botox or Dysport or Xeomin, and that really helps prevent etched in wrinkles, etched in lines. I really love it for the upper third of the face, so for crow's feet, for forehead lines, for the frown lines. You can really soften all those features, and it really keeps the person looking more youthful and happy and relaxed. There are some studies, weak evidence, that show that it can actually treat depression, because if you can't make a frown or a scowl, there's a biofeedback loop to your brain. And so it's just a great treatment. It's super safe. It's been around since the late 80s, and it's something that I do recommend if you're starting to feel like, what can I do to make myself look more rejuvenated? It's a great place to start. Those are the 5 things. I hope everybody has a great weekend, and happy Facial Plastics Friday.